Good afternoon, everybody. Thank you for joining us. My name is Mitch Bagley. I'm with our marketing and communications group here at Insurance Collaboration to Save Lives, and I'm privileged to be joined by our founder and president, Josh Stirling. And Josh, talk to me a little bit. You've been obviously very busy with the Insurance Collaboration to Save Lives this year. Talk to me a little bit about, one, why are you doing this? And two, what exactly is the Insurance Collaboration to Save Lives?
So, Mitch, it's great to be here, and I appreciate your help and everybody else who's watching the video and the folks who are here at the conference who come with us. The Insurance Collaboration to Save Lives is a global nonprofit of insurance leaders focused on improving health. We're focused on 3 M's. We want to mitigate mortality and morbidity. And the way we're going to do that is to screen, test, and triage at-risk policyholders to help those who are facing health issues which could lead to, catastrophic outcomes, serious declines, untimely death. Basically, we can help these people get the care they need, make the lifestyle choices that they need. And the reason it's the Insurance Collaboration to Save Lives is that we're all from the insurance industry, and we think the big opportunity here is to help the insurers. And we talk about engaging and enabling insurers to be able to do this, to save lives and to save money. And ultimately, we think this is an opportunity for the insurance industry to do good or to do well by doing good.
Absolutely. And we've had a lot of people from all across the insurance industry. What's kind of the feedback that you're getting from your insurance executives and leaders that you've been talking to?
It's incredibly positive. We've today, we were nothing a year ago. We were a couple of actuaries and a medical director and me as a former research insurance analyst, basically looking at the numbers and saying, it seems like deaths are up. It seems like disability's up. What can we do? That was a year ago. Today, we've got more than 1,100 followers. We've got hundreds of people on our email list. We've got 30 or 40 people who come to multiple meetings each week to manage this organization. We have a nonprofit we formed, and we've done meetings in 5 or 6 cities now in different countries, both here in the United States and internationally. And we're having conversations at the highest levels in the regulatory community, in the policy community, in the insurance leadership community. Here we are at an actuarial conference. The actuaries are very interested because it's about the numbers. But medical people, health people, the kind of feedback we're getting is very positive. Just yesterday I was reached out to one of the largest banks in America reached out to me and said, Josh, we want to help. How can we help with the Insurance Collaboration to Save Lives? Household name. This is from nothing a year ago. And the reason is this is working. It's not about us. It's that it's a powerful message. We've all gone through COVID. A lot of people have had their families and somehow upset through the variety of things that have sort of been, honestly, the poor health America had that was amplified by COVID. A lot of people have either suffered or known people who've suffered. This has led to a big opportunity, I think, for people to take advantage of the modern technology that exists to better manage their health. And from an insurance perspective, the opportunity to help customers, our policyholders, live better, healthier lives, it's very compelling. And so when we bring this message to insurance company CEOs and other types of people, they're like, this is really interesting. How can we help and how can we be involved?
Absolutely. And whether it's through our mini meetings per month or the pilot program that we ran, talk to me a little bit about what are the biggest finds that you've been able to, or some of the things that you've what have you most learned through this process?
Well, so I'll be honest. I've learned a ton about health. I was never really that interested in these topics. It wasn't something I ever thought about. I came from a medical family, but it wasn't something I was interested in. I was interested in business and finance and Wall Street and other stuff like that, insurance. So I've learned a lot about health, and the way I've learned about it is because we did a study. We basically identified, our actuarial team early on had done a lot of analysis of public health data, CDC data, government data for hospital admissions, Bureau of Labor Statistics data for disabilities. And you could see lots of things were elevated and lots of, there were signals that, maybe cardiac and circulatory issues and downstream things that are related like kidney and liver as well as like clotting and pulmonary embolisms or strokes. Again, blood related issues were very much elevated. But we wanted to be able to build a solution and not just write an actuarial report. So we did a study, or we did a pilot. We basically said, let's test all of our members. And it came from, one of our doctors suggested to me, Josh, why don't you test yourself? And I said, well, that's a great idea. I'm going to test myself, and if anybody else wants to, we can all get tested. And a lot of us got tested. From that, we found in our not large, but maybe 29 people population, largely insurance executives and their family and friends, 2/3 of us were healthy, based on our prior knowledge, but about 2/3 of us had a blood or cardiac or circulatory condition on at least one of the biomarkers we tested. 14% of us had 3 or more elevated conditions, so D-dimer, troponin, NT-proBNP, or HSCRP, which for the uninitiated, blood inflammation, heart damage, heart loss of function, or thrombosis, which is often called blood clotting. 14% of our group had 3 or more of those markers elevated above what's considered to be a normal baseline level. And what that teaches me, what that data taught me, is that there is a big problem out there, which the insurance industry can go help, which is people who have basically unmanaged heart disease or blood and circulatory issues, which they're not managing because they're not aware of them. And so the opportunity for us largely is for $50 or $100 per person to go test a bunch of folks and help these policyholders get the care they need, be proactively addressing these things so they don't get they don't have a stroke, they don't have a heart attack, they don't have pulmonary embolism, and ultimately live better, longer, healthier lives. That's a wonderful social thing. It's good for the world. It's also really good for insurers because it saves them money. And so we think that ultimately there's a very powerful synergy between doing good and doing well for the insurance industry, and we're really excited to be part of the effort to bring this, not brand new science, but sort of brand new way of thinking about using old science to an insurance industry that is really important, really powerful, really cares, and has an opportunity to evolve and make a big positive impact in today's world.
And through these health findings that we have not only gone through our own pilot program, but discussed with multiple doctors, how do you really see us being able to help it save 1 million lives, and how the insurance industry can really be a partner for us to do that?
The insurance collaboration is we're a Texas-based nonprofit. We're going to file for our 501c3. We're not going to do it. We are the research institute who is creating the knowledge, and then we're building the tools, and we're building and then we're recruiting the partners who are going to deliver these solutions. So what we really are is like an incubator for this whole new opportunity, for this ecosystem that doesn't really exist, but it's just starting to, which is basically the merger of health tech and insurance or insurtech, as well as this social need, this big opportunity, this white space that needs to be filled, which is the rise post-COVID in terms of mortality and morbidity, and particularly focused on heart and blood and circulatory and cardiac issues. We can help bring hundreds of new firms into this space: insurance companies, reinsurers, health tech vendors, hospitals, employers, the states, federal government. There's room for colleges and universities, public schools. The tools we have identified and are developing, and that we're going to make available basically for free to all these other institutions, we're going to save 1 million lives because we're going to get hundreds of thousands of other organizations ultimately to be deploying these approaches. And it's going to start in insurance, because at the end of the day, if we can save lives, we're going to save money.
And I would be remiss, you mentioned it a little bit earlier, we are at a major actuarial conference here in Indianapolis. And talk to me a little bit about how our actuarial partners and companies overall can really help this effort.
Oh, well, we love actuaries. I'm not an actuary. Every now and then I get accused of that because I like to use actuarial words. I'm just an analyst. But we love actuaries. A lot of our team has done really awesome actuarial work, both speaking to the public data that they're able to analyze, as well as about their own, in a confidential way, not specific, about the kinds of things they're seeing in their day jobs. And when we've spoken at other actuarial conferences in the past, we've done polls about, asking the actuaries, do you think this is going to continue to be a problem? And like 80% of them say yes, we think it's going to continue to be a problem. And so, we're getting a lot of support from the actuarial community. What actuaries can do is they can partner with us to try to advance this. Actuaries are very good at measuring and are very good at math. And what we're asking them to do is to step up and get involved and try to help take that brilliant insight about measuring and turn that into a solution focus. How do we save lives? How do we use the power of actuarial tools to try to identify who is it that needs to be helped? What do we need to do? Which of these treatment modalities or screening modalities is the best cost-effective return so the insurance industry can spend money on millions of tests and have positive impact? This is, I think, the power. It's the new frontier for actuarial science, is going to be not just how do we transfer risk to somebody by charging them premiums and then giving them a policy, or how do we manage risk for a company by measuring how much we have, but how do we mitigate risk, reducing the risk to reduce the cost of risk for the insurer, and in this case, to help people live longer, avoid untimely demise, and be happy and healthier, and be a benefit for their families. That's the opportunity for actuaries. And for the life folks, it's a lot of them are doing it because there's sort of some new emerging stuff in this space. But, this sort of stuff is very much old hat in P&C, where like inspections and risk management, risk mitigation, it's very central, especially in things like commercial lines where you inspect the building and you give the employee, and you say, well, you need to put in a sprinkler. You need to put in, you need to put in like the, we need you to improve your roof. We're not going to insure the property until you make these changes. There's a lot of opportunities, I think, for life to largely learn from these skills, or from some of the things that have been pioneered in other parts of insurance. So we're getting a lot of interest there, and that's where we talk to like life insurance technology companies who are like, yeah, this is awesome. We want to take our technology and take your idea about helping save lives and use it to sell more technology to insurance companies. And we're like, this is great. This is a way to advance our goals and help build a for-profit ecosystem around it.
And there's obviously a lot of momentum for what we've been doing for the past 6 to 9 months, past year. I know you've been very busy on the conference trail the last month or two. Where do you see us going in the next 6 to 12 months?
So we've never raised any money. And we're all volunteer and all part-time. However, we recently made a decision that we think we need to actually have a real organization. We're going to do some fundraising for the organization in 2024. More important, and that's not important because really the mission is the mission, but it's important because, to be honest, we're flooded with work. Success leads to success, and we have so much opportunity right now. We just do not have enough time, to pursue. And everyone, the folks who are here at the conference is wearing a red shirt. Everyone here has put their own money and time behind this. This is a volunteer effort. People are into this for thousands of dollars and thousands of hours of their personal time. However, what we really are is something like the Insurance Institutes for Highway Safety, or Underwriters Laboratories, or the National Association for Safer Buildings, which are all these like insurance industry focused, sponsored, paid for 501c3s that basically focus on safety, risk reduction, things like airbags and car crashes and building codes and electrical product safety. That's what we are, really. And we're focused on health and trying to empower all sorts of types of insurance companies to deploy that to reduce health. So we're going to have to focus on building the organization, which starts with talking to all the partners who are very excited about working with us and starting to say, hey, we can go further and go faster if we can start becoming actual partners. Recruiting some founding partners. We've got an awesome set of board members, leaders of large insurance companies. We're probably going to have to take it to the next level. But in the long run, and that's just for our organization, in the next year, our goal for the next year is very much to see some of these conversations we're having lead to pilot programs. We're talking to tech vendors. We're talking to insurance companies. We're talking to reinsurance companies. We're talking to regulators. We're talking to trade associations. We want to, and whether we get money off of this or not for our organization, the people who are volunteering are going to continue to volunteer and continue to do it for free, basically to try to help them deploy these for-profit strategies, which, our goal is to save 1 million lives, but we know to do it, it has to be a for-profit initiative because that's what drives that kind of scale. I think in 6 months you're going to see a lot of these products start to hit the market, and that's very much. I'm going to you know, just give an example. I'm going to InsurTech Connect next week, and I'm going to wear the red shirt. Well, I'm going to be there a couple of days and wear the red shirt one day and wear the white shirt the other day. And I'm going to wander around. And anybody that does health technology, I'm going to go to their say, this is what we're doing. We want you to help deploy it. You got great technology. We got a huge business opportunity. Can't pay you, but like we got customers that can.
They won't miss you in Las
They
Vegas.
won't miss me. And so we're going to this is going to be this is going to be the catnip for the cats. And so anyway, so if you ask me, where are we going to be in a year? We're going to have this deployed in a whole bunch of places. We're going to be a real organization, and we're going to be back here next year to tell you about the success.
Well, Josh, I think I speak for the entire group that we are very thankful for all the hard work and leadership that you have provided for our group, and we're very much looking forward to the future of what insurance collaboration to save lives entail.
Thank you, Mitch. Appreciate everybody's time today, and ask you to go to the website insurancecollaboration.org and take a look at our board members, take a look at our volunteers. If you know any of them, please send them a message. Thank them for their help. More importantly, let them know that you're interested, you watch the video, and we'd love to have you involved. Thank you.
Thank you, Josh.